So once again today we have just one slide, but this time it's a Masson trichrome stain. And the case is a pediatric case of Henoch Schoenlein purpura, a specialized type of IgA deposition in the kidney. And the beauty of a pediatric case is that you begin on a normal histologic substrate that basically before the disease process there is nothing else going on, there's no aging changes. And so it ends up with a lot more pure histologic change than you would find in adults. Okay, so I'm going to show you this case now of HSP, Henoch Schoenlein purpura, in a pediatric patient, Masson trichrome stain. So here where the arrow is, you can see cellular crescent. And you can see that the stain delineates the cells of the crescent a lot better than in previous videos where you've looked at crescents in PAS or H&E. And as we go up higher, you can also see that unlike the situation you'd find in an adult biopsy, the surrounding tubules are not atrophic. They have normal thin basement membranes which stain blue, and so that's quite different from what would happen probably if you had severe glomerular disease like this in an adult patient. Okay, I'm just going to show you this a bit more with higher power lenses. Okay, so if we go up higher now on the crescent, you can see this is what the crescent looks like, this structure here. This is somewhat solidified glomerular tuft. So there's more scarring and more proliferation and accentuated lobulation in this part of the tuft as opposed to this. So it's a somewhat segmental lesion with the crescent down here. So I talked about the absence of tubular atrophy in the surrounding tubules. And if you keep going up, you can find an inflamed area between these two glomeruli, somewhat solidified glomeruli. There is this interstitial inflammatory infiltrate. And if you go up higher on that, you can once again see that the surrounding tubules have a delicate basement membrane. You can see where the arrow is there. That's the basement membrane. It's of normal thickness. So these are not atrophic tubules, despite the fact that there are all these inflammatory cells in the interstitium. So just a sort of different way of thinking about pediatric kidney disease and the ways that it differs frequently from kidney disease that you might find in an adult patient. And you can see that this stain really brings out the features of this biopsy better than an H&E, PAS, or a silver. can see the fibrous intimal thickening here. This is the fibrous intimal thickening. The arrow is pointing to here. So that's what I wanted to show you and get you thinking about some of the differences commonly between pediatric and adult kidney biopsies. That's it.